1. The impact of missed flights on rural health in Hawaii. 2. Addressing transportation barriers in Hawaii's rural health care. 1. The impact of missed flights on rural health in Hawaii. Imagine your life hanging in the balance because of a cancelled flight. For rural Hawaii residents, transportation barriers routinely turn medical emergencies into tragedies. Our University of Hawaii research team spent a year documenting how unreliable travel creates deadly healthcare gaps, especially on Molokai and Lanai, where a delayed plane often means a misdiagnosis or postponed surgery. Here's what we discovered, and more importantly, how we can fix it. Healthcare systems routinely fail those furthest from urban centers. Emergency responders described unsustainable pressures. Some rural patients wait up to 2 hours for ambulances, a fatal delay during strokes or heart attacks where minutes matter. But here's where it gets alarming: the state's few medical helicopters create dangerous bottlenecks when multiple emergencies occur simultaneously. For non-emergency care, the problems compound exponentially. Traveling to Oahu or Maui for specialized treatment requires companions and lodging, costs rarely covered by insurers, while frequent flight cancellations force patients to skip vital appointments. Molokai and Lanai face particularly dire air service instability. The insurance maze worsens these gaps. Medicaid patients endure weeks-long approval delays for basic transport and get minimal companion coverage, while traditional Medicare provides zero non-emergency travel benefits, an outrageous gap affecting vulnerable seniors. Private insurers. They largely avoid covering medical travel costs altogether. How can we tolerate this systemic neglect of rural communities? Solutions exist through coordinated action. First, we must overhaul emergency services by conducting needs assessments and investing in ambulances, rapid response vehicles, and exploring a public air ambulance program like Senate Bill 3126 proposed. For non-emergency travel, subsidized inter-island flights and community-based travel coordination could bridge gaps. And this is the controversial part: we must mandate insurance coverage for medical travel, requiring Medicare to cover NEMT and forcing private insurers operating in Hawaii to cover transportation, lodging, and companion costs. Is it fair that profit-driven insurers avoid these essential services? Preventative strategies offer promise too. Telehealth expansion through village hubs, mobile maternal clinics, and improved broadband could reduce travel needs, but only if we invest in equipment, provider training, and regulatory changes. For pregnant mothers, grants could fund travel housing while incentives attract specialists to neighbor islands. Could ferry systems or sea gliders become sustainable alternatives? The state must explore this while improving airline accountability through complaints systems. Hawaii's geography shouldn't dictate survival odds. With political will and smart investments, from EMS upgrades to insurance reforms, we can ensure equal care access across all islands. But I'll leave you with this provocative question: when corporations profit from healthcare while neglecting rural transport needs, is that institutional malpractice? Share your perspectives below. We need bold dialogue to drive change. 2. Addressing transportation barriers in Hawaii's rural healthcare. Imagine living in a tropical paradise where accessing emergency care means waiting hours, or even days, for help to arrive. For thousands of Hawaii's rural residents, this isn't a hypothetical scenario, it's a harsh reality. A groundbreaking new report from the University of Hawaii's Rural Health Research and Policy Center exposes the devastating transportation barriers strangling healthcare in the island's most vulnerable communities. Here's what you need to know. The crisis in numbers. Despite 30% of Hawaii's population residing in rural areas across 6 islands, specialty care is overwhelmingly concentrated on Oahu. Residents of Molokai and Lanai, for example, routinely face flight cancellations, missing urgent appointments and waiting months for rescheduling. Non-emergency transport. Costly and unreliable, with insurance gaps leaving patients to foot exorbitant bills for travel, lodging, and food. The situation is dire for maternal-fetal care. Pregnant patients often must relocate to Oahu for prenatal care or risk emergency medevac flights. It's not just delays, it's a matter of life and death, John Desford, policy analyst at UHRHRPC, emphasizes. Improving access demands coordination between healthcare, transport, and policy. We hope this research sparks action. The report's findings are stark. Ambulance wait times, emergency responses in rural areas lag critically behind urban standards. Insurance blind spots, patients ineligible for Medicaid face catastrophic out-of-pocket costs for travel-related care. Maternal health emergency, relocation burdens and delayed care threaten both mothers and infants. But here's where it gets controversial. Proposed solutions include mandating non-emergency transport coverage in all Hawaiʻi insurance plans, a move critics argue could raise premiums. Other ideas: enhancing ambulance fleets, community paramedicine programs, and subsidizing housing for relocating maternal patients. The report also calls for leveraging federal essential air service funds to pressure airlines into improving reliability, a tactic some label heavy-handed. The unspoken question: can Hawaiʻi afford not to intervene? With maternal health outcomes at risk and preventable emergencies escalating, the economic and moral costs of inaction are mounting. As Amy Grace, principal investigator, notes, community stories drove this project. Now, it's time for policymakers to listen. Call to action: dive deeper into the full report, link, and join the Hawaiʻi Public Health Institute's August 18 webinar to weigh in. Your turn: should insurance mandates take precedence over cost concerns? Can technology, e.g., telehealth, fill the gap, or is systemic overhaul the only answer? Share your thoughts below. Supported by the Hawaiʻi State Department of Health, webinar registration, link.